Good afternoon, everybody. I want to set out our plan for managing COVID this autumn and winter, and I want you to cast your mind back exactly a year and think where we were last September as schools went back and the colder months approached, because in one way, our position today is actually more challenging. We have higher levels of daily cases, thousands more, but in many other crucial respects, the British people, all of us collectively and individually, are incomparably better placed to fight the disease. We have more than 80% of all over 16s now double vaccinated, and we have COVID antibodies in around 90% of the adult population. And those vaccines are working. We've seen the extraordinary vaccine-induced falls in deaths and serious disease, and depending on your age, you're up to 9 times more likely to die, sadly, if you're unvaccinated than if you've had both jabs. And the result of this vaccination campaign is that we have one of the most free societies and one of the most open economies in Europe. And that's why we're now sticking with our strategy. In essence, we're going to keep going. We will continue to offer testing. We'll continue to urge everyone to be sensible, to be responsible, wash your hands, use ventilation, consider wearing a face covering in crowded places with people that you don't know. Stay at home if you feel unwell. Download and use the app. And we're investing massively in our NHS to meet the pressures of COVID, with an additional 5.4 billion in England over the next 6 months, and that's on top of almost 36 billion over the next 3 years to help our NHS recover and fix the long-standing problems of social care as well, as I was saying last week. And we're helping to vaccinate the world with 100 million doses for developing countries by next June. And I think this country should be proud, continue to be very proud, that the Oxford AstraZeneca vaccine remains the workhorse of global immunisation. And we will keep further measures in reserve. Plan B. We do not see the need now to proceed, for instance, with mandatory certification, but will continue to work with the many businesses that are getting ready such a scheme. Indeed, over 200 events have already used COVID certification voluntarily. And it's just not sensible to rule out completely this kind of option now, when we must face the fact that it might still make the difference between keeping businesses open at full capacity or not. We will also keep open the option of mandating face coverings as they have elsewhere, or advising people again to work from home, reflecting the fact that when you've got a large proportion of the country, as we have now, with immunity, then smaller changes can make a bigger difference and give us the confidence that we don't need to go back to the lockdowns of the past. And of course, we'll continue to update our advice to you based on the latest data. But in the meantime, we are confident in the vaccines that have made such a difference to our lives. And we're now intensifying that effort, offering jabs to 12 to 15-year-olds on the advice of the chief medical officers who've given that advice based on the health, well-being and educational prospects of the children themselves. And for over 50s and the under 50s who are at risk or more at risk, we're now motoring ahead with the booster programme, a third dose 6 months after your second dose. And so that's going to mean we're going to be building even higher walls of immunisation, of vaccine protection in this country. And the UK government has procured at scale jabs for every part of the UK, and we'll be sending doses to the devolved administrations in Scotland, Wales and Northern Ireland. COVID is still out there. The disease sadly still remains a risk. But I'm confident that we can keep going with our plan to turn jabs into jobs, and protect the gains that we've made together. Thanks very much. I'm going to ask Chris, I think, to do the slides. Chris.
First slide, please. The first slide is the number of people testing positive for Covid-19 in the UK. As everybody, I think, knows, there was a significant dip during the middle part of the year, started to rise in June and July. There was a peak which then eased off, but there's been a gradual drifting up over the last few weeks. It's stabilised over the last week, but I think we should be careful neither to overinterpret nor underinterpret this. At the moment, things have stabilised to some extent, but we are, as I'll come on to, going into a more difficult period of the year. Next slide, please. And the number of people in hospital with COVID has inevitably mirrored this. And what we've seen is, again, a gradual drifting up of the number of people in hospital. It is not anywhere near yet the point it was in the first peak and in the subsequent peaks at the early part, end of last year and the beginning of this year. But there is a gentle upward trend, variable around different parts of the country. Next slide, please. The good news, of course, is that the number of people who are dying following a positive test for COVID-19 is significantly lower, proportional to the number of cases, than it was at the end of last year and the beginning of this year. But these numbers, again, are not trivial. By any means. Every one of these, of course, is a tragedy for the family. So around 140 deaths in terms of the 7-day average. And again, this is gradually drifting up, but very slowly. Broadly, this is flat to just drifting up. Next slide, please. And the number of people who've received a vaccination for COVID is also increasing, both for second doses, people who've previously been vaccinated getting their second dose to really strengthen their protection, and also for first doses. So those are the trends, and I think they've been widely circulated in various media outlets over the last few weeks, but that was just to bring people up to date. Next slide, please. We did, however, want to add just 3 additional slides because I think these make a point and reinforce the points that the Prime Minister has just made. This first slide, these are Public Health England data, shows the number of people with COVID-19 coming to emergency care within 28 days of a positive test. That just means with COVID in most cases. That led to a hospital admission by vaccination status. And what you can see is that in every age, there is a very substantially smaller proportion risk of doing this if you are vaccinated than if you're not vaccinated, in every age. And actually, if you if you sort of just do a very crude look at the numbers, someone who is in their 30s and unvaccinated is running about the same risk as someone in their 70s who is vaccinated. It's that level of difference. And I really want to reinforce why people of every age should be trying to get vaccinated. And one of the most depressing things for doctors, including myself, is talking to people who have just chosen not to get vaccinated because it wasn't convenient at that particular moment, and you see them being wheeled down to intensive care, and you know this was a very serious problem as a result of them not being vaccinated. We really must encourage everybody we know to get vaccinated. The great majority of people who have not been vaccinated is not because they're against vaccination, but because they just haven't got to doing it, and we're about to enter winter. Winter is coming, and people really should take this seriously. Next slide, please. And this is even more clear if you look at the mortality rates, which again are very starkly different between those who are vaccinated and those who are not vaccinated. So I really would encourage, and I'm sure all of you would encourage, everybody we know to get vaccinated and then double vaccinated. So the 3 sort of layers of defence from vaccination, 2 new, the first one, children and young people 12 to 15, which we talked about yesterday. Today, discussion of people getting their booster doses, who've already had 2 vaccines and getting a third. But the third, and arguably the most important, is that people who've had no vaccines should be encouraged to get their first and then their second vaccination. This is really critical. Next slide, please. And the final point, really, with the data, is this is a comparison of where we are now, and this reinforces very much the point the Prime Minister made at the beginning of his opening remarks. In 2021, in the orange line, and along the bottom is the dates, and where we were in 2020. And what you can see in this is that this time last year, we were only beginning to get the takeoff that you see in autumn and into winter. And we're entering the autumn and winter period at a much higher level in terms of number of cases, in terms of number of hospitalizations, and in terms of number of deaths than we were this time last year. And the reason that it's possible for that to be happening, and the NHS under extreme pressure, but not at the point where it was by any means at the turn of the year, is because of vaccination. But we are entering the winter with this reasonably high level. It wouldn't take many doubling times to get into trouble, and therefore people still need to take this disease very seriously, because I don't think you need a medical degree to know that autumn and winter is when respiratory viruses are hugely advantaged, flu and others, as people come together indoors, windows closed and so on. So it was really just a reinforcement to people. If you've not had your vaccination, now is a very good time to do so. Thank you very much.
Thanks very much, Chris. Patrick, anything to add to that? Let's go to questions there. Thanks very much. Let's go to questions from the public. First, Michael from Dorset. Michael asks, the government suggested in March 2020 that 20,000 deaths from Covid-19 would be a good result. Why then is the PM not doing anything to prevent even more unnecessary deaths? Well, Michael, I'm not certain that that was what we suggested, but what we are doing, of course, with all our policies is to, and everything we've done since the beginning of the pandemic, is to prevent unnecessary deaths. Everyone has been a tragedy, but I think I'm right in saying that I think I saw a statistic from Public Health England saying that the vaccination programme alone had saved perhaps 100,000 lives, maybe 120,000 lives, and that's why what Chris has just said about getting your jab is so absolutely crucial. Thank you, Michael. Kirsty from Leeds. Can the government advise on when the strict travel rules will ease further for those that are fully vaccinated, and advise on what determines a country's list? At the moment, travellers are confused about where they can go when countries that have low COVID rates and good vaccinations are still red. Thanks very much, Kirsty. I appreciate that people are very frustrated about the travel rules, but it is vital that we do whatever we can to stop the virus being re-imported, and particularly to control new variants when they're at risk of coming in. That's why we have the rules. That's why we have the red lists. And I know that travellers have been frustrated this summer in having to take tests in order to do it. But I think it is reasonable to ask people to do that to help protect the population. We'll be saying a lot more shortly, Kirsty, about the traffic light system, about simplifying it, and about what we can do to make the burdens of testing less onerous for those who are coming back into the country, Kirsty. But that will be coming shortly. Let's go to questions from the media. Vicky Young from BBC News.
Prime Minister, could I just start on behalf of all of us by extending our condolences to you and your family after the loss of your
Thank you very much.
Could you tell us in what circumstances you would impose those extra restrictions, your plan B? Do you have a number of cases, a number of hospital admissions, which would mean that we've passed that threshold? And a similar question really to Professor Whitty and Sir Patrick. When do you think extra restrictions should be imposed?
Well, Kirsty, Vicky, sorry. First of all, thank you very much for your kind words, and to many others who've said the same. But on your point about Plan B and when it and how and what the trigger might be for that, I think that just bear in mind what we're trying to prevent, and that is the overwhelming of the NHS, and that's got to remain the objective. At the moment, and we're confident we can proceed with with Plan A. But I think what I would stress about Plan B is that it contains a number of different shots in the locker, and you wouldn't necessarily play them all at once. Far from it. You'd want to do things in a graduated way. And I just emphasise what I think Patrick has said many times, that we're now in a situation when, because so many of the population have some degree of immunity, smaller changes in the guidance, smaller changes in the way we're asking people to behave can have a bigger impact, and a smaller tilt on the tiller, if you want, can affect a bigger change in the direction of the pandemic. And maybe Patrick can say more about that if you want. Patrick, you want to?
Yeah, I mean, we've got high levels of immunity now, and if, as Chris said, we can get everybody who's not vaccinated to be vaccinated, so that's the most important thing we can do. There are 5 million or so people who are eligible for vaccines now who haven't been vaccinated, and trying to persuade those people it's the right thing to do to get vaccinated would make a significant difference. So getting that immunity up means that then the barrier against rises is that much greater. If you think about where we are now with infection rates and the openness that we've currently got, if you tried to do this 6 months ago, the number of cases and deaths and hospitalizations would be through the roof. So the immunity is really important to keep this down, and allows lighter measures to be put in place to keep it under control. That said, the things to look at are hospitalizations. They are really, really important as a marker of when things are going in the wrong direction, and the relationship between cases and hospitalizations, because one of the things the vaccines has done is made that relationship really much less. So if you saw that changing again, that would be a cause for concern. So those are things to look at. And the final thing to say is that the principles which have been really clear, I think, right the way across the world, are when you make a move, you have to go earlier than you think you want to, you have to go harder than you think you want to, and you need to make sure you've got the right geographical coverage. So if this goes in the wrong direction and cases go up, followed by hospitalizations, it's important that the measures are put in place early enough and they're significant enough.
Thanks.
I'd add slightly to that, PM. I mean, I think, in addition to what PM and Patrick have said, I mean, there are three things which I think is worth looking at. The first of which is the absolute numbers going to hospital. The second, though, is the rate of change. A gradual drift up is one thing. If you suddenly saw a very rapid increase, then you have to consider taking earlier action. And the third of which is the overall state of the NHS, which of course does vary over the year, and as you go into winter there tend to be greater pressures. So these are all the kinds of things that will need to be taken into account. But no one is claiming there is a good number. We would all like the numbers to be as low as possible. But in terms of what might trigger change, those are the things which I think are the most likely.
Good. Thank you very much. Robert Pesson, ITV.
Obviously we're all relieved at the way in which the vaccine reduces severe disease. Actually, I've just myself recovered from COVID, double vaxxed. But as your chart showed, numbers going in hospital are 5 times what they were a year ago. Sorry, 4 times actually. Deaths are 5 times what they were a year ago. And as you pointed out, we're about to get colder weather. We're going to be indoors more. Kids are going back to school. What is the argument for not taking mild suppressive measures now as a preventative measure? And separately, on boosters, you'll have seen the Lancet paper, scientists from the WHO, American FDA and others, and we've seen what Sarah Gilbert said in Oxford. The argument for, in their view, the argument for boosters is not overwhelming, and many of those people think we'd be doing a better job sending those vaccines to countries that haven't got any vaccines at all at the moment, particularly places like Africa. Why do you disagree with that judgment? Because it is an important judgment difference.
Who's that aimed at?
Well, the scientists for the latter one, and all of you for the question of why not take, prophylactic action, even of a mild sort, now.
Just say to you, Robert, on that, because the vaccines have made a huge difference in reducing mortality. So the ratio of cases to serious disease and deaths is vast, and we are continuing to advise everybody to be sensible and responsible. So Plan A, what we're doing at the moment, continues to continue to think about using a face covering in a confined space when you're meeting people you don't know. Wash your hands, use ventilation, get a test, stay at home if you feel unwell. These are very, very important restrictions that I think people, or ways we behave responsibly, that people should continue to maintain. But I think that's the right balance, given where the pandemic is at the moment and given what we've been able to achieve. And I think that the priority should be for there are literally 5 million more people who could get a vaccination and who haven't yet done so. And those are the people that I think we should be encouraging now to come forward, get your jab. It will be good for you for the numbers, the reasons that Chris has set out. You're overwhelmingly more likely, sadly, to die or to suffer serious disease if you haven't been vaccinated. And so vaccination, I think, should be the key thing we advocate.
Can I just add to that? So, firstly, on the measures, if we had a situation where everybody was back to behaving as they did prior to March 2020, we would have a much higher rate than we do at the moment. So actually, people are taking measures. Everybody's taking, but lots of people are taking measures. They're meeting with fewer people. Good research demonstrate that. Many people are wearing masks in crowded places and all the other things that the Prime Minister has talked about. So it's not that we're not taking measures. There are quite a lot of measures, and lots of people, probably the great majority of people still, are taking some or a lot of measures to reduce the risk that they and other people get infected, in addition to being vaccinated, which, as the Prime Minister has said, is the most important thing. So I think you shouldn't just say there's nothing happening. There clearly already is. On boosters, I think it's important to separate out two things, which I think if they get conflated, leads to confusion. The first one, which everyone would agree with, and the Prime Minister said in his remarks, is everybody agrees we want to get vaccines out all around the world, including low-income countries. That is an absolute moral imperative. It is also an absolute practical imperative for everybody, and everybody agrees with that. That isn't a contentious point. The second question is there some waning of immunity that means that a third dose, a booster dose, is a sensible thing to do? And I think there is now reasonably good evidence that that is the case. The UK has taken, in a sense, a middle way on this, led by the JCVI. It has neither said no boosters at all, because there is evidence of waning, particularly at the top end of the age range and in those who've got pre-existing health conditions. And those are the groups that JCVI have actually recommended it, in addition to health and social care workers, because of the chance that this is going to reduce the probability they will infect others. So there's a very good logic, but they've not gone all the way of recommending universal boosters for everybody. So they've taken a middle path, which some nations have gone for. But the logic of the boosters for the UK I think, is clear and science-based, and the ethical imperative, as well as the overall need to do that, I think, is widely agreed. And those two, I think, are separate discussions. If we suddenly stopped having boosters, given the particular vaccines we're using, which are the mRNA ones with very ultra-cold cold chains, actually at the moment not long, very long shelf lives, the idea that's somehow going to transform the situation in lower-income countries, I think, is a misunderstanding. I think those are separate issues, but both are important.
Yeah, just to build on that, and I agree completely with what Chris has said, if you think about the degree of immunity we've got and the levels of behavioural restriction that people have imposed upon themselves, so people aren't meeting as many people, we know contact patterns are still quite a long way down compared to where they were, but they are changing quite fast. The faster they change, the more pressure this is going to come under, and that may well lead to a significant increase. If you look at, go just across the channel, countries where you've got similar levels of immunity and some higher degrees of restriction, what you can see is that the cases are going down. So you can see we're sort of at that pivot point where things are flattish at the moment. If they go up quickly, then as I've said, you've got to go early in terms of getting on top of it. You can't wait till it's late because you have to do more. So that's sort of where we are on that. And on the boosters, the waning of immunity is clear. It's greater for infection than it is for the waning against hospitalizations and deaths. So they're holding up very well. And I want to just say the really important point is these vaccines are really good. they are really effective vaccines, far more effective than we could dare to hope for at the beginning. So this is some waning, and that waning is most evident in the people who are most at risk. And so getting on and getting that topped up does two things. It gives a very high level of antibody coverage, and it probably broadens the coverage across variants as well, because you've got such high response. So I think it's a sensible thing to do. JCVI have considered it very carefully, and I think their recommendation is a very sensible one.
Great, thanks. Gary Gibbon, Channel 4.
Thank you very much. Professor Whitty, you talked a bit about the metrics for how we might decide we've got to move from Plan A to Plan B, lockdown light, maybe. What about the trigger? Is it most likely, do you think, that it'll be a new variant that would actually change the game here? Is that the real game changer that you'd be expecting to transform the horizon there? And when the Prime Minister said he would urge people to consider wearing a face mask in crowded indoor places, you say we're in a very serious condition. Is considering it enough? And Prime Minister, on vaccine passports, you said in this building in July you served notice that you're planning to bring them in. Were you really planning to bring them in? Were you just trying to get the numbers up of younger vaccination? We've then had lots of other mixed messaging, which isn't great in public health. What's going on?
Chris, you want to go first on that?
Thank you. In terms of new variants, certainly new variants are one of the things we need to look seriously at. Now, of course, variants are happening the whole time, have always happened. What we need, the worry would be one that can escape from the vaccination. So the Delta variant is a very bad variant. I mean, let's be very clear, it's a very bad variant, and that's the reason we've had such trouble in the last year, as every country around the world. We have not faced a winter with the Delta variant. So it is possible that the combination of winter events plus the Delta variant, which is highly transmissible, could lead to a situation where, on the basis of the data, ministers decided that they wanted to trigger all or some of the Plan B, as the Prime Minister's laid out. So I think we have to take it as it comes. I think anybody who can say with confidence they know how this is going to work over the next few months has not fully understood, I think, the range of possible ways this could happen. But certainly, were there to be a variant that was both transmissible and escaped from the vaccines, that would put us in a new situation. And no doubt the Prime Minister would come back and explain where he wished to go at that point in time. But we're not at that point in time. I think at the moment our expectation is the Delta variant, but over autumn and winter is what we face at the moment. And then in terms of masks, I think my previous suggestion to people remains my view, which is if you are in a crowded environment, particularly if you're in an indoor space, wearing a mask is a way of helping protect other people. Being vaccinated really helps protect them, but it's not a complete protection. People can get infected and they can transmit vaccinated. There's much lower probability to both of those. Wearing a mask helps to reduce that. It's not something you need to concern yourself so much if you're outdoors in highly ventilated areas. And the other area where I think it is sensible is if actually you've got people around you who wish you to do so, either because they've got medical conditions or simply because that is their desire. I consider it an issue of common courtesy. There are a number of situations you would want to wear a mask, but that's not universal, and it's a recommendation. It's not something which the government has put into regulation.
Excellent, thank you. And look, just Gary, on your point about COVID certification and vaccine passports, as it were, I really do defend these in principle. I think it was right to set out in July that we could go forward with those measures. And actually, what has happened is, I mean, if you think about a year ago, where we were, last September, can you imagine if we'd had then COVID certification, we would have been able, with that tool, to keep open businesses that had been forced to close and were going through an absolutely wretched time. There would have been a total game changer, lifesaver last year. And so I think that they're important they're an important part of our repertoire. And it's great that loads of events have been working to use them. People have been making the system work. And as I said earlier on, we may because of where the disease gets to. We may have to use them in a more thoroughgoing way. We reserve the right to come back to you and say we think that that's going to be necessary. And I do think the public understand that. They can see how it could work. There are plenty of other countries that are doing it right now. But at present, we don't think it's necessary to proceed on that basis. We think that we can keep going with all the stipulations that I mentioned and Chris reinforced that we're asking people to observe. We think that's the right balance given where the data is now. But you've got to be mindful that this disease does have a way of changing and moving. What is absolutely for certain is the vaccines made a vast difference. And if what I hope people take away from this press conference, above all, is not perhaps the importance of Plan A or Plan B, but that fixing that gap in the number of people who have had their vaccine of whatever age, and that statistic about the risks to an unvaccinated person in their 30s seem to be very, very powerful. And I would just, the numbers are going up, and it's very encouraging to see how many people are coming forward to get vaccinations. And I would just urge everybody who, is still a bit apathetic about it to join the club, because it's, worthwhile. Steve Swinford, The Times.
Professor Whitty, one of the world's biggest female celebrities, Nicki Minaj, has today publicly linked the coronavirus vaccines to impotence. Now, she's got 8 million followers on Twitter. Many of them are young people, the young people you're suggesting should get vaccinated. What would you say to them, and how concerned are you by public comments like that from public figures? Prime Minister, SAGE and SPI-M have both advised that the government, that working from home is one of the single most effective measures at reducing transmission. But looking at your autumn and winter plan, it's not actually part of Plan B. It seems to kind of hover as some kind of Plan C with a decision on its shelf for a later date when we actually look at the document. Why are you more reticent about deploying working from home to combat this? And one last question. Prime Minister, a lot of your cabinet are feeling very anxious as we're gathered here today about their own futures. Can you formally rule out a reshuffle ahead of the Conservative Party conference?
Chris, on the reshuffle.
Thank you, Prime Minister. So there are a number of myths that fly around with varying, some of which are just clearly ridiculous and some of which are clearly designed just to scare. That happens to be one of them. That is untrue. My own strong suggestion, if I may, to media present and not present, is repeating them in public actually just gives them credence, which they don't need. They're untrue, full stop. If you think about where we are actually overall, and this is a slightly longer answer to your question because I think it's a very important one, the great majority of people are getting vaccinated. So the great majority of people are ignoring these myths. And if you talk about people in their 50s and 60s and 70s, you're talking about over 90% of people getting vaccinated, and very few people actually are actively, in a sense, in the anti-vax group. There are a group of people who've got strange beliefs, and fine, and they make their own choices, and in a sense, also fine. Adults are allowed to make their own choices, however strange. That is a basic principle of medical ethics, actually. But there are also people who go around trying to discourage other people from taking a vaccine which could be life-saving or prevent them from having life-changing injuries to themselves. And many of those people, I regret to say, I think know that they are peddling untruths, but they still do it. In my view, they should be ashamed. And I'll leave it at that.
And just on that, Steve, I'm not familiar with the works of, or not as familiar with the works of Nicki Minaj as I probably should be, but I am familiar with Nikki Kanani, superstar GP of Bexley, who's appeared many times on before you, who will tell you that vaccines are wonderful and everybody should get them. So I prefer to listen to Nikki Kanani. And on your point about working from home, this is one of those things where I think just look at what the public are doing. I think people are coming back to their offices. That you're seeing the numbers that I'm reading suggest that people are more confident. They're getting back into their places of work for the reasons I've given many times before. I think that that's a good thing. I think that on the whole, particularly for younger people. You need the social capital you get from the workplace. You need the learning from colleagues. I think that will, on the whole, be more productive, and it's fairer to everybody if we can do that. But people are also being sensible and responsible. If we have to change the guidance that we give on that, then we will. But that's Plan B. As you've heard earlier on.
Can I just add to that, Prime Minister? I mean,
yes.
The point about something like working from home, it's about contact patterns. And in a way, this is all quite straightforward, that the disease spreads much more rapidly the more contacts we have. And in certain environments, the more contacts you have are more risky. And working from home is just a way in which contacts inevitably go down. So that's why it was highlighted as a particularly effective measure to decrease spread at times when you have big increases in levels.
Thanks. Lizzie Buck in the Mirror.
Thank you, Prime Minister. You've spoken about reserving the right to use vaccine passports, and the Plan B document states that they could be imposed for nightclubs and large venues, but it doesn't entirely rule them out mandating them more widely. Are you considering imposing them in pubs, or would you like to rule that out? And to the scientists, what are your views on the evidence behind the use of vaccine passports? PHE found that they mitigate the risk of transmission, so why are we not using them now?
Thanks very, very much. But no, Lizzie, look, I've never been in favour of vaccine passports for pubs. I've been, I think, pretty clear about that throughout the pandemic. But I do think that there are settings, as we put it, nightclubs, large music venues, and so on, or venues with big, closely packed crowds, where they might be appropriate. As we all know, some events have been using them over the summer very effectively to get going, and I think it would be sensible for a government not to rule that out.
In terms of the question to us, I mean, the question about whether it's a passport is entirely one for political leaders. That's a legislative and societal one. From the science point of view, though, I think nobody would doubt that you're safer off if you go to any indoor venue where everyone around you is vaccinated. It reduces the probability they will get COVID at all. It reduces the probability if they do have COVID, they will pass it on. And if everybody in the environment is vaccinated, the chance of a mass spreading event is very substantially reduced because everybody's got it. So things that are to encourage everybody to get vaccinated, particularly if they're going to large mass events indoors, the evidence that is going to be a good idea is rock solid. How that's done is very much a matter for ministers.
Good, thank you. Adam Payne, Politics Home.
Thanks, Prime Minister. A question for you, please, on the potential mandating of vaccine passports. Michael Kill, who's the CEO of the Nighttime Industries Association, told Politics Home today that the government's handling of this issue has been chaotic and that Plan B could force nightclubs and venues to make massive logistical changes at a moment's notice. What's your message to Michael and that industry, and to Professor Whitty and Sir Patrick, please? Do you have any data on the effectiveness of the booster shot? Professor Ferguson yesterday said a study in Israel suggested people were 10 times less likely to catch mild disease after receiving a third dose. Do either of you have any information you can share on that, please?
Yes, so thanks very much, Adam. On nightclubs and the whole nighttime economy, we want to keep it open. And the big difference between this year and last year is that thanks to vaccination, we are able to keep it open. It's a great thing. We just have to be sensible and look at the risks that we face. And I think that some sort of COVID certification system of a kind that plenty of venues have been using already might well be sensible. We're working with the industry, including the nightclub industry, to make sure that they understand what could be required of them. And of course, I understand the frustrations of people who are wondering whether or not they're going to have to put this in. At the moment, we're confident that you won't, that we'll be able to proceed without it. But the choice is, and the reason for wanting to have this option is because it's a choice that then between proceeding with COVID certification, or sadly once again asking places to close. And I certainly don't want to do that. So that's why I think it's a good idea to keep this up our sleeve and keep this in reserve.
And on boosters, I mean, it's very clear that the booster shots cause a very big increase in antibody responses, and that would be expected to have a very big knock-on effect for protection in terms of infection and hospitalisations and death. So I think the data look pretty clear on that.
One just final point, which is on the first one. I think a lot of people believe young people aren't taking up the vaccine. Not true. The great majority of people 16 to 29 have already taken up their first vaccine and are taking up their second. So the idea that this is just a minority of younger people who haven't is completely untrue, and we should always start from that basis.
That's right. Thanks very much, everybody. Thank you. Thank you.